Today I want to talk with you about wound care. I will start with this case. This is a 70-year-old female with history of diabetes who came to the emergency department 2 days after she was bitten by a dog on her lower leg. This is what the wound looked like when she came in. What do you want to do? Or what would you do? Would you send her home and tell her there is nothing to be done? Would you start her on antibiotics and refer her to the surgery clinic in 3 days? Would you admit her for IV antibiotics and debridement in the OR? Would you call surgery to the emergency department? Or would you take care of it yourself? Reassuring her and sending her home would be a matter of negligence. Starting her on antibiotics and referring her to the surgery clinic would be a matter of malpractice. Admitting her for IV antibiotics and the surgical debridement is a very good option. And requesting a surgery consult in the emergency department would also be a good option. I opted to care for her myself. A very important rule to follow is never do any procedure on any patient if you're not comfortable. How did I proceed? Number one, an IV was inserted and labs sent. Number two, the wound was infiltrated with lidocaine. Number three, the wound was irrigated and cleaned with chloroprep. The number four, a sterile area was established. Number five, a wide incision was made. And number six, debridement performed. This is the wound prior to debridement compared to the wide incision that was made, and after irritation to the wound to allow bleeding to occur. After extending the wound, I irritated the tissue, causing it to bleed, and this actually mimicked a fresh wound. Again, it's a comparison to pre and intra-procedural appearance. I performed extensive debridement in the emergency department. This is what it looks like. She was started on antibiotics in the ER and was discharged with the same. Tetanus was also administered. As you can see, the wound is absolutely different from when she initially came in. My patient did very well and healed without complications. Now, let me make a few general statements about wounds. In terms of the history, the important components are, number one, the mechanism of injury. Number two, the time the injury occurred. Number three, the past medical condition of the person with the injury. The next is the physical examination of the wound. This should include the location of the wound, the size of the wound, the depth of the wound, the shape of the wound, if there is any contamination in the wound, foreign body in the wound, infection that might be present, devitalized tissue, and of course, the neurovascular status of the area of interest should be determined. In terms of the treatment of the wound, the most important component is irrigation, copious irrigation, preferably with tap water if possible. Bite wounds from dog, cat, and human should not be sutured. Also, the three methods of closure of a wound are primary closure, secondary closure, and delayed primary closure. Primary closure may be done with sutures, staples, and adhesives. In secondary closure, the wound is allowed to heal by granulation tissue. This method is used when the wound is contaminated, the edges are far apart, or time lapsed between the time of injury and the time of seeking care. In delayed primary closure, the wound is cleaned and observed for a few days, then surgically closed. The last thing I want to talk about is lidocaine. What is the maximum dose of lidocaine without epinephrine? The maximum dose of lidocaine without epinephrine is 5 milligrams per kg. What is the maximum dose of lidocaine with epinephrine? The maximum dose of lidocaine with epinephrine is 7 milligrams per kg. What is the duration of action of lidocaine? The duration of action is 30 to 90 minutes. Lidocaine 1% equals 10 milligrams per ml, and lidocaine 2% equals 20 milligrams per ml. Before I close, I want to mention wounds caused by bites. The organism transmitted by dog bite is Pasteurella. The organism transmitted by cat bite is Pasteurella Multocida, the same as in dog bite. The organism transmitted by human bite is streptococcus and Eikenella. Well, thanks for watching, and remember, if you're not comfortable, don't do it. Please remember to like, share, and subscribe. I wish you well. Good night.